Hi, I'm Peter Chirico with Chirico Physical Therapy and Wellness. And today we're going to talk about what to do if you've had uh, back or lumbar spine fusion surgery and you continue to have pain afterwards. We recently had a case where a patient did have a lumbar spine surgery and continued to have severe pain afterwards. We were able to get her in for a thorough evaluation to see if we could help determine what the cause was of her pain. If there is pain, there's something causing it, and we needed to find if there's any predisposing factors that may be doing that. When we evaluated her, we looked a little deeper and a little lower, and we noticed that she was having some dysfunction at her hip region levels, and that when we treated that, her pain started to go away within a matter of 2 or 3 visits. Her pain progressively lessened to a minimal to no to none, and she was able to function independently again. So if you're had a back surgery or fusion and have continued to have pain, it's unlikely that you will need a second surgery to correct whatever the first one didn't do. Please take the time to look into whether there's something else going on that was overlooked, and save yourself the trouble of a surgery, a major surgery, that can be solved non-invasively. So please, if we can, we'd love to help people. If we can help you, please give us a call. Our number's 909-345-3370. And I hope this video helped you or a friend of yours that's been in this situation. If you want to reach out to us, you can also connect to us through our website at Chirico PT or Chirico Physical Therapy and Wellness. And I want to thank you for your time and wish you a good day. Bye-bye.